Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And today sees the release of a very harrowing report into maternity care at East Kent Hospital. The maternity service in this country is appallingly bad. I did a video the other day explaining the terrible things that are happening and why so many midwives are leaving the profession in droves. Well, today sees the release of a particularly bad report about a particularly bad hospital. And it is quite sad. We're going to go into it, but just to prepare you for it, there are some terrible things in it. But we're going to look at this and to say, why are we putting up with a level of service that is positively medieval? Here goes. So, getting in, she lived for a week but never opened her eyes. Harrowing account of a mother who felt blamed for the passing of her daughter at a maternity scandal hit East Kent Hospital's trust. As damning report with evidence from 200 families is published today. 200 families. This is how widespread and awful this is, and it's been going on for years. For years. The review into failings at East Kent Hospital Trust due to be published this morning. The inquiry was led by Dr. Bill Kirkup and looked at more than 200 cases going back to 2009. The report expected to describe how up to 15 newborns passed due to poor care. The NHS Trust boss warned maternity staff to expect a harrowing report. The governor has resigned this morning, citing a cancer at the top of the organisation. He was at the top of the organisation. He could have done something and didn't. So he's resigned. Well, at least he's resigned and saves us firing him. A mother who lost her newborn baby at the hospital at the centre of a maternity scandal at East Kent Hospital's Trust told how her daughter lived for a week but never opened her eyes. Helen Gittos lost her newborn daughter Harriet at the Queen Elizabeth the Queen Mother Hospital in Margate in 2014. One of the hospitals being probed as part of the independent review set to be published this morning. Miss Gittos has told how she was felt blamed for the passing of this baby and was horrified to learn that maternity staff had written in her notes that she and her partner had refused medical care when they had not. This is a cover-up. This is a hospital that knows what it's doing and is covering its back and is blaming others and is lying on reports. This is the level of care that you're getting in the NHS in this country. It is not good enough. It is not even approaching good enough. It is appallingly bad. And in this case, evil. It's absolutely evil. There's no other way of describing it. They, through their lack of care, caused the passing of a baby. And then instead of taking the blame, putting their hands up and apologising, are blaming the parents and are lying in reports about what the things the parents have said and done. These people who run this hospital, never mind resigning, they should be doing time. She was born very, very poorly, Mrs. Gittos said, and she lived for about a week, and she looked so well, but she never opened her eyes and she never cried. Harriet died 8 days later after being born, having suffered a brain injury during her birth. Miss Gittos told the BBC Radio 4's programme that she felt the hospital's reaction during her labour had not been swift enough or decisive enough. She said, at the time, to us it felt as though the reaction was not swift enough or decisive enough. I was forced to listen to a list of risks about having caesarean section and forced to sign a consent form when it had already consented to having a C-section were it to be needed. They should have already just gone in and done that. They know the risks. They know these risks. What were they trying to do? Save some money. It just felt terrifying that nothing was happening fast enough and there was this miscommunication going on. This is the trouble. They act like gods. They act like they're doing you a favour by treating you. They're paid out of taxes. They are not gods. She also explained that there was a doctor shouting in her face that she would harm her baby if she did not sign the form, but she was physically unable to. Ms. Gittos said that amongst the very worst moments of the ordeal was being told that maternity staff had written in her notes that she and her partner Andy had refused medical care when they had not. It has become clear that when in labour we'd ask questions, is this the right thing to do? Should we do this now? That kind of thing. And they were all treated as being non-compliance, Ms. Gittos continued. They said they were being treated as refusals of medical care when we never refused anything at all. So hearing this doctor tell me this is amongst the very worst moments of it all. Their baby died. and the hospital are blaming them and then making up lies that they refused treatment when all they were doing was asking. Because informed consent. It's the heart of all medical treatment. It comes as a harrowing independent review looked into an alleged maternity scandal at East Kent Hospitals Trust, probing the deaths of up to 15 newborns, and it is due to be published this morning. More than 200 families gave evidence. It was triggered by the death of newborn Harry Richford in 2017, with one midwife describing the panic during the attempts to resuscitate him. Head of publication Dr. Kirkup said an expert panel investigating maternity care at East Kent Hospitals heard a lot of harrowing accounts from families during their work. I'll be settling all of that later for the families first and then for everybody else. But there were a lot of common factors, and my heart goes out to everyone that this has happened to. Questioned about some families receiving care without compassion, he said, I'll be setting that out in detail in the recommendations. I think what I would say at this point in the morning is I understand that people work under pressure, but that doesn't excuse or explain being rude or aggressive. That's a different kind of problem. It's just not there. There's Morecambe, there's the Midlands, there's North East, there's Cornwall and Devon. It's all over the country. And it's management trying to save pennies here and there. It's doctors under pressure. It's midwives under pressure. It's too much money wanked away on shit and not enough money put to where it's needed. But also these doctors need to learn compassion. They do have a God complex, a lot of them. He says, this cannot go on. We have to address this in a different way. We simply cannot respond to each one as if it's a one-off. It is not. It's systemic. It's not a one-off. It is across the board, across the country. He said we have to do things differently. The government is expected to respond later today in the Commons to the report. That's possibly not going to happen given the news elsewhere today with the government. I mean, seriously, who needs Game of Thrones when you've got House of Commons? It's just ridiculous what's going on, and then nobody's going to take ownership of this. And this report is likely to sort of slide into ignominy and obscurity. And that is why I'm bringing it to you today. Please don't let this report disappear. Keep this, share this video, get people to talk about it, let them be aware about how bad the maternity system in this country is. It is horrendous, it says. And he says, while there have been some positive changes in leadership, including your appointment as chair and the appointment of a new chief executive, there remains a cancer at the top of the organisation. I believe officials on six-figure salaries continue to mislead, obfuscate and bully and conceal vital information. They lie and they bully. They lie and they use force to get their own way to save their jobs. Well, screw them all. Anyway, I'm going to come up and round off. It's a terrible, sad state of affairs that we live. We're supposedly a modern country, an up-to-date, rich, wealthy country. And we have healthcare that is third world and third rate. And I speak from experience. Anyway, I shall finish there and come up. We need to get rid of all the managers. Yeah, I mean, all right, have one or two. You do need some sort of admin control. But you don't need the sort of multi-layered onion approach to bureaucracy that they've got in the NHS now. Fire 80% of all these managers and use the salaries to get in more maternity work, maternity ward nurses, midwives, specialist doctors. You can do it if you stop wasting money on roles that aren't needing to be filled. And also, these managers are then worried about numbers, worried about reports, worried about what people will think. And so they pressurise doctors and nurses into doing things like this. It's an appalling state of affairs. Doesn't help that they're wasting untold millions on woke wankery as well. That needs to stop. Put the money where it's needed. Frontline healthcare, not gold-plated salaries for, tossers in grey suits. Anyway, I shall stop it there before I get mad and angry. Thanks for listening. If you like what you hear and see on the channel, please hit the subscribe button if you haven't already. Ring the bell for notifications of future output. Like it, make a comment. Definitely share this video. We need this one shared. We don't want these reports to die. We need them out there. And until next time, stay safe, stay well, punch a manager in the gob, and goodbye.